What are some of, I guess, the biggest misconceptions you think are out there about addiction and recovery?
Oh boy, I
There's
can
so
talk
many.
for hours. Well, okay, the biggest one that is so grating to me is the belief in the community that addiction is a choice,
Mm.
and that people who suffer from addiction, who overuse certain substances, have a character disorder, and that they are characterologically bad people. And there's significant research to help us understand that it's way more complex than that, and that many people with addictive illness have pre-existing brain vulnerability. And then added to that, some of them, not all, have life trauma that creates a synergy that can put someone at risk for addictive illness. My son is adopted, and he was learning disabled, and I think he was bullied as a child, but I do think that he had biological loading for addiction that pre-existed any trauma. So I think, I'm not saying it's one or the other. I think it's a dance between life experience and genetic loading. So that's certainly a big thing. I think the other horrible truth about addiction is that treatment is misguided. It tragically often focuses on abstinence and a refusal to understand that that's not a clinically informed attitude. And don't even get me started about how outraged I am about the fact that people who are in treatment and then have a reoccurrence, which used to be called relapse, which I hate that word, but they have a reoccurrence of their condition, that they are kicked to the curb. They're asked to leave treatment at the very time when they may need more wraparound services, more engagement, more emotional support, uh, more support in every way. So those are the two biggest errors, but there are a multitude of them.
Mm-hmm. Actually, to add, I wanted to ask a little bit more about what you said. You said you don't like the word relapse,
No.
which I appreciate. Can you explain why you don't like that word and you choose the
yes,
word you use?
If a person, so I am borrowing from the analogy that addictive illness is, in fact, where the brain, in a way, is it serves the individual in some ways, but in many ways it's a problem. We call it addictive illness. I know people are offended by that. They call it an illness. But I actually think that we need to have, to think of breast cancer. We don't say that someone whose breast cancer has come back, that they're relapsing. The word relapse implies, again, some willful decision making, that someone's opting to choose this path. And I find that totally offensive and against the truth of what's going on. That if many of my patients have had a reoccurrence of using for complex reasons that have to do with, maybe I had one woman have a reoccurrence when her husband committed suicide. I don't know how much choice was involved in that. I think she needed something, and the substance was very soothing for her at the time.
Mm-hmm. Yeah, definitely. And I think that really speaks to kind of bring in the mindful perspective. I think that you are very mindful about how you speak about it. And so that's a much more mindful perspective, recognizing that relapse is assuming that there's a choice, assuming that there's a decision made, and there's a judgment behind the choice to label it as relapse. And I think that kind of speaks to that treatment, not always, but traditionally, I think a lot of treatment was much more judgmental, and much more labeled people, and kind of tended to push people into the margins. And I think that recognizing that, it's a reoccurrence rather than a relapse, and not judging someone and actually offering them more treatment is a much more mindful way to treat somebody as a whole.
Absolutely. I think there's another word that offends me, and basically that's graduate. A lot of the programs have graduations
Yeah.
for people.
Yeah.
And again, if we borrow from breast cancer or some other lifelong medical struggle like diabetes, the person might have remission for a while, but that we're not asking them to graduate to somehow no longer have that issue. We need to have compassion and understand that many of these folks will struggle with this issue for a lifetime, but and that there's no harm in having reoccurrence. There's no it's all right. It's part of the course of the condition, and that we need to again work with them in a very compassionate and clinically informed way.
Yeah,
I actually used to work in a neonatal intensive care unit, and I've been trying to promote a form of neonatal program for people with addictive illness. What I mean by that is in a neonatal unit, a newborn can go up and down in the unit according to the acuity, the severity of the illness. And I think that there need to be programs where people are welcome wherever they are in their illness, and that if they need, if they have reoccurrence, they are welcome to be on like the main floor where they have safe injection sites and showers and food and emotional support. And if they want to get better, they can go up a floor and they can have an opportunity to have safe, clinically informed detox. If they get better, if they want even more, they can go upstairs and have long-term therapeutic recovery with psychotherapy and CBT. I think we need NICUs for people with addictive illness, where you're welcome wherever you are in your illness.